Have you ever wondered how food allergies impact people's lives? It's a question that 20 million individuals in the United States, including 4 million children, grapple with daily. Food allergies are not just about avoiding certain foods. They require constant vigilance, a lifestyle that revolves around label reading, and a heightened sense of caution when eating outside the home. Imagine being Anabelle Terry, a 12-year-old girl with severe peanut and tree nut allergies. Even a tiny amount of nuts could lead to an emergency visit to the doctor, making something as simple as eating a cupcake a potential health risk. This is the reality for millions of people living with food allergies, where a single bite can mean the difference between a normal day and a medical emergency. So, what if a drug could drastically reduce the risk of severe allergic reactions? In the next scene, we'll introduce you to a game-changing medication that's offering new hope. Enter Xolair, a drug that's been around for more than 2 decades. Initially approved for treating allergic asthma, this game-changer is now making headlines for a completely new application. It's a familiar face wearing a new hat, so to speak. You see, Xolair, or omalizumab as it's scientifically known, was originally designed to mop up certain cells in our bodies that trigger inflammation and allergic reactions. These cells, called immunoglobulin E or IgE cells, activate the immune responses that can lead to asthma attacks. Xolair, acting like a sponge, helps to take these allergic antibodies out of circulation. But what if I told you that these same IgE cells are also involved in food allergies? It was this realization that prompted scientists to explore the potential of Xolair in tackling food allergies. And they weren't disappointed. A recent study published in the New England Journal of Medicine reported that Xolair allowed people with food allergies to tolerate higher doses of allergenic foods before developing a reaction. What's more, it also led to milder reactions if they were accidentally exposed. Armed with this new data, the U.S. Food and Drug Administration decided to expand the approval of Xolair on February 16, 2024. This expansion allows Xolair to be used in the treatment of food allergies in anyone 1 year or older. This makes Xolair the first drug approved to treat allergies to multiple foods. But it's important to remember that Xolair does not cure food allergies. As always, individuals must continue to avoid allergy-causing foods by diligently reading labels and asking how food is prepared. However, with Xolair, they now have an additional layer of protection in case of accidental exposure. This journey of Xolair, from an asthma drug to a potential game-changer in the world of food allergies, is a testament to the power of scientific discovery and innovation. It's a major step forward, but how exactly does Xolair work? Xolair fights allergic reactions in a unique way. This drug's mechanism of action is akin to a meticulous janitor, tidying up our immune system. It operates by mopping up cells known as immunoglobulin E, or IgE for short. These are the culprits behind inflammation and allergic reactions. Imagine these IgE cells as tiny alarm bells, ringing loudly and causing a ruckus whenever they encounter something they perceive as a threat, such as allergenic foods. This ringing, in turn, activates the immune cells responsible for inflammation and allergic reactions. Now, Xolair steps in like a sponge, soaking up these IgE cells and effectively silencing the alarm bells. This mechanism was what initially led to Xolair's approval for treating allergic asthma. You see, IgE cells also play a significant role in that condition. However, the potential of Xolair extends beyond asthma, reaching into the realm of food allergies. Food allergies are pretty straightforward. They're almost entirely an IgE-driven reaction. This makes Xolair's IgE mopping action particularly suited to tackling food allergies. As it turns out, while asthma has a plethora of triggers, food allergies have a narrower focus, making Xolair's mechanism a vital tool in the fight against them. Now that we understand how Xolair works, let's look at the results of a recent study. A recent study has shown promising results for Xolair's impact on food allergies. The research, published in the New England Journal of Medicine, involved children with food allergies, and the outcomes have been nothing short of remarkable. Take Anabelle Terry, for instance. This 12-year-old, who suffers from severe peanut and tree nut allergies, noticed a significant improvement during her participation in the trial. Anabelle once accidentally consumed a cupcake made with cashew flour, a mistake that could have led to a severe allergic reaction. However, thanks to Xolair, her reaction was considerably milder than expected. An antihistamine was enough to quell her symptoms, a far cry from the epinephrine shot and doctor's visit that would have been necessary before Xolair. Now, it's important to remember that Xolair does not cure food allergies. The necessity to avoid allergenic foods, to meticulously read labels, and to ask about food preparations remains. However, Xolair does offer an added layer of protection in case of accidental exposure. This means that individuals with food allergies can live with a little less fear of severe reactions and a little more peace of mind. Despite the need for continued caution, Xolair offers a new ray of hope for those living with food allergies. This drug, originally developed for allergic asthma, is now poised to make a significant difference in the world of food allergies, and that indeed is a cause for celebration.